Okay, welcome everyone. Thank you so much for being here tonight. I again apologize for those who have been part of the group for a while that I haven't had one of these for a little while, but we've had some renovations going on, but I hope to bring you more of these coming up very soon. And if you're new to the group, we are based in Columbia, Maryland, but welcome anyone, anywhere. And this is for people who are interested in whole food, plant-based eating and people who are already doing it. Okay, so tonight's guest is Dr. Nate Gershfeld, and he is a doctor of chiropractic and has a medically supervised fasting program called the Fasting Escape. And he will be talking tonight about his program, which can be done online, and what the health benefits are to fasting, whether or not that can help you with your particular health challenges, whatever they may be. So I'm going to go ahead and spotlight him now. And he has a slide presentation for us. If you have any questions, please put them in the chat and I will ask him at the end. Okay, Dr. Gershfeld, go ahead.
All right, thanks so much. Thanks for having me, everybody. And so, yeah, as Sharon said, my story began back when about 18 years ago. And I was an electrical engineering student and had a health challenge. My grandmother's a chiropractor. She was a chiropractor. And she recommended, okay, it's time to change your diet. You have to stop eating so much junk food and you have to go do some fasting. So I went up to True North as a patient and I ended up reversing and significantly improving my health condition. And as a result, after I graduated engineering, I promptly decided that I was going to go become a chiropractor. So I changed my career. And ever since then, now I've been in practice about 11 years now. And I've been helping people do water fasting since. So I did an internship at True North Health Center. I was on staff there for about 3 years after my internship. And then I came down to Southern California and started my inpatient fasting clinic and ran that for a few years until the pandemic. And I actually got busy during the pandemic, but many patients who were unable to travel due to the COVID restrictions or they were nervous about COVID, they started requesting that I do some remote fasting supervision and guide them through essentially the same program that they would have done had they come to a clinic. And so we started doing that and a lot of people liked it. And so now we are a only remote fasting supervision program where you get supervision from me and then as needed.
Dr. Gershfeld, you're coming in and out.
Oh, let me actually put my microphone here. Is this any better?
Yes, thanks.
Okay, sorry about that. Is this any, let's see, can you guys hear me now?
Yes.
Okay. All right. And so where did we leave off here? So I'm now doing remote fasting with a doctor supervised remote fasting program along with myself and then my medical director, Dr. Renee Thomas. And so today's talk, Sharon and I were talking about whether or not there would be something useful to say for the group. And the question that people ask me often is whether fasting would benefit them. And so we thought this may be a good talk to discuss is whether or not fasting can help you overcome certain health challenges and what fasting is and how we think about these problems. And so really what this is to tell you the story of balance and how it really relates to overcoming your health challenges. So whether it's something straightforward, like just getting back on track with a healthy diet, or it's something very serious, like maybe an organ or even a systemic disease, it could be even chronic or acute. What we have to keep in mind is that your body has what it takes. In many cases, in the majority of cases, your body has what it takes to improve itself, to improve your own health, and to improve your own life. So what I'd like to do is to actually take a time machine out, and we're gonna transport ourselves about 120, 150 years ago into the mid 19th century and the early 20th century. And let's imagine what life looked like back then. So in terms of lifestyle, sanitation was really the biggest problem. Okay, poor sanitation was rampant. It was not common to wash hands. Indoor ventilation was extremely poor. And oftentimes, actually, one case that was written about in Vienna, doctors would go directly from an autopsy of an infected patient who died from an infection straight to examining living pregnant patients. And this was resulting in these pregnant women dying at triple the rates than they were dying with when they were examined by midwives. And so this was, at the time, this was why, if we look at the leading cause of death in 1900, the top 3 leading causes of death were all microorganism related. And so as germ theory started to become better understood, it became known that there were microorganisms like bacteria, viruses, fungi that actually could infect someone and eventually cause death. But there really wasn't much that could be done about it once infected, because there was no known solution at the time. The only solution at the time was actually to prevent it by avoiding all sorts of contamination. So, and making sure that, for example, if you're getting examined by your doctor, that you're actually making sure that they're washing your hands, that you're washing your hands, and that you're not spending a lot of time around people who you believe to be sick. Now, you can understand, given this this kind of state of the world at that time, you can understand what kind of a breakthrough it was when scientists discovered antibiotics. Okay, with the invention of and the discovery of antibiotics, doctors could now successfully fight an active, potentially life-threatening disease. And for this, the doctor who discovered this, Paul Ehrlich, he received a Nobel Prize in medicine, and rightly so. So this was the state of the world. And after antibiotics became more prevalent, the leading causes of death now, let's fast forward about 120 years later. Bacterial contamination is almost unheard of. And in terms of the leading causes of death, other than with the very old and the already very sick, they are almost non-existent. And so in addition, now 120 years later, medicine has been advancing at great pace. It's given us many great advancements. And these advancements are mostly seen in terms of emergency procedures, surgical techniques, elective surgeries, these types of things. And on the other hand, though, if we look at the leading causes of death, we're going to go to 2019 because we had the COVID differences in the death the last couple of years. But the most recent reasonable leading cause of death statistics says that the most of these are now heart disease, cancer, stroke, diabetes. If we look at the top 10 leading causes of death, 8 of them are actually lifestyle and diet related. And the treatments for these diseases are very largely disappointing. And so, for example, for diseases of the heart, high blood pressure, which is the single biggest predictor of all of these leading causes of death, other than accidents and suicide. So if you take a blood pressure medication, it really only corrects the blood pressure while you take the medication. And if you don't take the medication, your blood pressure will elevate. Same thing goes for diabetes. If you take the medication to bring your blood sugar down, it only really works when your blood pressure, when you're taking your medication. And so you're essentially doomed to be taking the medication for the rest of your life. Now you can imagine when Paul Ehrlich invented or discovered antibiotics, what kind of response he would have gotten if he said, "Okay, you have an infection, now you have to take this medication for the rest of your life, and if you stop taking it, you're going to get the infection again." Okay, you might be asking, they might ask him if the antibiotic even works, okay, if they thought that way. And so these medications are really disappointing when it comes to long-term success. And so it makes me wonder why we're so good at seeing the cosmos through the telescope that you see here, why we can see even bacteria through the microscope, yet we aren't that good at seeing how it is that we can actually get healthy. Okay, so the question is, what is it that we are missing? And that's what we're going to try to find out here. So fighting disease in the way that doctors did for antibiotics or for life-threatening illnesses works very well for certain diseases, like a major acute infection, for example, significant physical trauma, emergency room type stuff. Okay, this is because the cause of the problem is known and it's being addressed. And in the case of an emergency room situation, the only time that they will use medications to, say, numb the pain or symptomatic relief is when they're just need to get to the actual problem. And so they're just using it as a way to get to the major issue, i.e. we're going to take some pain pills. And even though the pain pill is not going to solve the problem, we just need to numb the pain so we can, dig the shred, the glass out of your arm, for example. Okay. The problem, however, is it does not work. This approach, fighting the disease, does not work very well for illnesses caused by improper diet and lifestyle. And the reason is because the cause of the problem has not been removed. And instead of fighting these diseases through chemical alterations, the focus, I'm submitting to you that the focus should actually be on strengthening the body's own natural ability to heal itself, i.e., let the body heal itself and get the heck out of the way. And so, for example, if I cut my hand, there's nothing actually that's been discovered in the world of medicine that can help the body heal faster than it can heal itself. Okay, so that's really interesting to know. So no matter what you put on it, antibiotics, you can put butter, toothpaste, any kind of, any type of remedy that you can think of, nothing can help that body heal itself faster. However, there are ways to slow down the healing. Okay, we can, first off, like if the splinter is still inside, okay, if I'm rubbing my hand over sandpaper, okay. Now, for example, if I'm taking a bunch of drugs, drinking alcohol, getting sleep deprivation, that will all slow down the healing of the body. And so the first step to get out of the way and let the body heal itself would actually be, first off, remove the splinter from the wound, i.e. remove the cause. Then we're going to look for anything else that could be slowing down the healing, i.e. clean out the wound, maybe get that dirt out of the way. If there's any bacteria, you can wash it out and see if you can get enough of that bacteria washed away. And if it's deep, stitching it up, okay, maybe even considering antibiotics, and then watching it carefully as it heals. But what we have to keep in mind is that none of these things are actually doing the healing of the body. They're actually allowing the body to take care of itself. We're just getting things out of the way. Okay, so the body can heal itself if we remove the proper obstacles. The body can heal itself in many ways if we remove the proper obstacles. So this way of thinking is actually what drives people like yourselves to seek lifestyle changes. Okay, when they have health problems, year after year, studies continue to come out confirming that this is possible. So whether it's Dean Ornish and heart disease, as has been demonstrated, whether it's diabetes, as Dr. Neil Barnard has written about, whether it's overweight, like doctors like Dr. John McDougall, Dr. Goldhamer have written about, autoimmune diseases, in every single case, even cancer, in most cancers, the same steps for allowing the body to heal itself is used for virtually any chronic illness in the same way that the general principles of a healthy diet and lifestyle are virtually identical no matter what the disease. Okay. And so what you might find every so often, though, is you may meet a well-meaning scientist, some healthcare provider, a friend they are the one who's searching for the magic cure. Okay, they're searching to win their Nobel Prize in medicine. Okay, there's plenty of people around. They're desperately trying to fight the disease rather than to help the body heal itself. They want to discover the antibiotic equivalent for these chronic lifestyle diseases. Okay, whether it's a pharmaceutical drug, some other type of product, we'll let history tell us how successful they actually were. But in the meantime, until that day comes, until we can actually demonstrate a cure, we want to keep things very simple and focus on the most important general principles for improving your health. Otherwise, if we don't do that, we risk getting very distracted, and it can sometimes reduce our motivation to actually improve our life if we believe that someday, some way, we're going to get some cure for this that'll prevent us from having to exert a whole bunch of effort into improving our life. So here are the most important general principles for improving your health. The first one is healthy diet. Okay. Now, some of you might be thinking that this is a cheese block, okay, but it's actually not. Okay, it is a crude representation of the fruits and vegetables intake in America versus the animal and the refined foods currently consumed in the United States. Okay, so we have a very small sliver of the piece is going to be vegetables and fruits and starches, and the rest is going to be animal foods and refined carbohydrates. Okay, the latest estimate is about 93% of calories are coming from these foods. And so some people do very well when they do completely whole plant-based. That's obviously what we're shooting for. But in any case, however we move the needle, we're eating way too much junk food and way too few fruits and vegetables. Okay, so general principle is actually going to be moving towards a whole plant foods diet. If we don't do this, what's waiting for us is a lifetime of disease and debility. Okay, this is perhaps the most important principle for improving your health, and it just happened to be this way. Okay, it could have been clean air. It could have been clean air. It could have been something else. Okay, but food is going to be a common thing. Okay, and so we want to be keeping this in mind. Okay, now there's a lot of other kind of advertisements that are in play here, and they subtly signal to us what's waiting for us at the end if we actually are not able to consume enough fruits and vegetables in our lifetime. And this was a coupon I saw at the store. At first I thought it was a 2-for-1 deal. Like if you get the Pop-Tarts, you get the diabetes for free, but actually it's actually a coupon for diabetic medications. And you can see it's perfectly placed right near the foods that they believe and they know that diabetics eat. Okay. So here's another coupon as well. So this is a marketing strategy. This is no accident. Okay. So we want to be very careful. There's all sorts of conflicts of interest out there that are trying to get us to override our long-term health in order to get healthy food. Okay. The next principle is going to be sleep, getting good night's sleep. So just a little background about sleep. When you sleep, the brain recharges. It shuffles through your day's memories. It stores them, it discards them. This is what causes dreams. And then this is all done so that that you wake up alert and clear-headed. Now, your self-control, your attention, your memory, they're all reduced when you don't get enough sleep or when you don't get the right kind of sleep. And your brain is very picky when it comes to sleep. In order for you to feel, for you to wake up feeling rested, your brain needs to move through an elaborate series of cycles, okay, several rapid eye movement cycles. And if you don't get enough sleep, and if you don't get the right kind of sleep, you'll actually wake up feeling tired, which means you haven't had enough time to clear out the debris in your brain. Okay, so we want to be very careful with substances that disrupt our sleep, whether it's the phones, whether it's stimulants, these types of things. Now, exercise is another common principle for improving your health. And how much exercise are we talking about, and what kind of exercise? Well, the data is out as very, very specific ones. Now, I just recommend, generally speaking, about 30 minutes a few times a week. And this can include endurance, could include weight-bearing exercise, could be stretching. 30 minutes a couple times a week. And I remember a patient asked me one time, Dr. Gershfeld, does it count if 5 minutes of exercise feels like 30 minutes? And I said, yeah, it does, but you want to start to improve your cardiovascular system if it feels that heavy. But start somewhere, even if it's starting for about 5 or 10 minutes of dancing in the living room. Start somewhere so that you're moving your body. Okay, this is it's unheard of nowadays. It's unheard of in the Stone Age, back when our ancestors were around, to be trying to exercise. You just happen to naturally do it. You had to walk from place to place. You had to engage in some pretty serious, strenuous physical activity in order to get anything done. And so it's a little bit unnatural. So we want to try to build up our exercise tolerance as we improve that. The fourth one is sunshine. So depending on where you are, I looked up the angle of the sun in Maryland, where this group is based out of. But for many of you who are in all but the northernmost states, you'll be getting plenty of sun, even starting in March. And so you want to get out in the sun, test your vitamin D levels. It's very important for your body to be exposed to sunshine. The other one is emotional support, or a loving social circle. Those kind of go hand in hand. And we look at our ancient ancestors, they were deeply connected. There were no such feelings of isolation like we have today. And so we all have to do what we can to forge those types of connections. There's also very big differences between our ancient environment and today. So in the age of our ancestors, we had one village, okay, and maybe a couple of different small groups. But today, it's possible to be part of half a dozen villages, leaving almost no time for your own personal balance. So we want to focus on the people that matter, and people that we like, people that we meet, people that we love. If we don't do that, we will get out of balance very quickly, because we will fall through the wayside if we are a part of too many things. And the final part here, this is the main part of my practice that we talked about in the beginning, is fasting. So the definition of fasting is the complete abstinence of all food and drink except for water in a complete environment of rest. Now, what goes on inside the body when all food and drink are removed has been an adaptation in humans as a response to scarcity of food and periods of famine. Not all animals are able to go without food for a very long time. Perhaps the most well-known animal that fasts is the bear during hibernation. Okay, so in humans, however, fasting has been used therapeutically for centuries. Okay, so we don't actually fast for several months like the bear does, but fasting has been mentioned in every major religion as a way to cleanse, to purify, to rest the body, to have some sort of spiritual enlightenment to some degree. And so fasting has been around for a long time. Our bodies are able to go without food. And if we look at the previous principles of getting out of the way, it turns out that in the majority of ailments, fasting, going without food is the quickest process for getting out of the way to let the body do its job. So we're removing the cause. In many cases, the cause is going to be the food that we ate, the air that we breathed, some sort of exposure to something. We're removing obstacles to healing, i.e., we're redirecting energy away from digestion towards the healing process. And we're watching it carefully to make sure that nothing is going dangerous, no dangerous levels are happening. And then we give it enough time. And usually when hunger returns, that's a good time to break the fast in these acute illnesses. So if you've watched a child get an acute illness like the flu, the desire for food disappears very quickly. This is your body's way of initiating the fast towards healing directing energy towards healing the infection rather than digesting food. You've also probably seen some of this similar instinct in your pets. Okay, so if I remember growing up, and it was always curious to watch that when my dog would feel very sick, she would go into her little dog house and she wouldn't come out for a couple of days. Okay, and she'd come out thinner but feeling much better. And this didn't happen very often, obviously, but it was very curious that when I started reading about fasting, this is something that other animals have also adapted in nature. And what I want to go over next is some of the other benefits that I've observed in practice and that other doctors, other scientists have also studied during fasting. So the first one is going to be weight loss. Now, most people, when they do some water fasting, they may be overweight. And fasting can benefit some of the weight loss. Weight loss is about 1 pound per day on average. Mostly is geared towards visceral fat, the fat surrounding your organs, and also some water retention. And it could be a useful way to reduce some weight, but really what we're trying to do is come up with a long-term food plan and a sustainable plan so that we don't need to use fasting as this quick fix. Okay. And where that comes into play with overweight is we recognize that when people are unable to control the amount of food, there may not be anything wrong with their psychology. It may be more so that the food that they're eating is actually addictive. Okay. So people rarely will be overeating on broccoli and apples and carrots and potatoes. Mostly it's going to be when you're adding in a whole lot of salt, when you're adding in a lot of oily, refined foods, fried foods, and processed animal foods, these types of things. Those are way easier to overeat. And so this is where we take advantage of the brain's ability to adapt to sensations. So let's now backtrack a few months ago was Christmas. Okay. So some of you may have gone into a house that has a Christmas tree, and the minute you walk in, you can smell the Christmas tree. Okay. And in about 10 or 15 minutes, you actually will get used to it. Okay. So your sense of smell detects a new sensation, and then you will adapt to it, and then you can't smell it that much anymore. Okay. This is called neuroadaptation, and it happens in all of your sensory organs. So it happens in your sense of smell. It also happens when you are in a normally lit room, but you go outside into the bright light, and all of a sudden the brightness of the sun looks incredibly bright. You have to squint your eyes a little bit. And then it takes about 10, maybe 15, 20 minutes for your eyes to adjust. And all of a sudden, as long as it's not incredibly bright, you can actually adjust to that. And then again, the same thing happens again when you go back to the normally lit room. Is it's going to look dark, and in about 10, 15 minutes, your eyes will adjust. So I want you to pause and consider that this same thing happens when you are eating highly processed, highly stimulating foods that has a large amounts of salt, sugar, oil, other types of flavors and flavor enhancers in it. is that you can imagine how difficult it can be for someone who's struggling not to overeat, to abstain from the foods that are causing their weight gain. And it can be very frustrating experience, because the people who are genetically a little bit slimmer, they will say, oh, you just have to eat less and move more. Okay. And it's complete BS, because if it were that easy, then nobody would be overweight. Okay. What it is, it's hijacking. Your taste buds are unable to enjoy the food unless it's got a lot of that stimulation. And so this makes it very difficult for your body to reach for the healthier food. Now, as it turns out, if you were locked in a zoo, like some subjects were in London, years ago in a UK zoo, and you were only fed fruits and vegetables, it may only take about 3-4 weeks, maybe a little bit longer, for your taste buds to adjust. And all of a sudden you go through the curve of those foods tasting terribly. And all of a sudden now the foods taste amazing. Okay. That's actually sustainable. You can actually eat healthy food and like it. Now we have a chance to actually improve the weight. Okay. And so this may take about 1 to 3 months of just eating the food. But as it turns out with fasting, when you take all food and all sensation off the taste buds other than pure water for a period of time, you actually shorten this process. Instead of waiting 1 to 3 months, we can sometimes see effects of 4 or 5 days, maybe a week or two, depending on how saturated your taste buds have become. Okay. So in just a week or two of water fasting and then a proper refeeding, you can get that short circuit, the neuroadaptation of your taste buds. And now you're eating a healthier diet is much more sustainable because it actually tastes good and you don't have to suffer too much. The next benefit is natriuresis. Okay, this is the body's process of removing extra salt and therefore the water retention as a result of that. So, like we talked about earlier, a lot of modern foods that we're eating contain very large amounts of salt, and your body's adaptation to consuming more salt than it's used to is to actually retain more water to balance that out. And where this actually plays the biggest role is going to be when you increase the volume of your blood from the water retention, your blood pressure goes up. Okay, now blood pressure is a function of a few different areas. So what we just talked about is the increased blood volume. But we also have, at the same time, when you have more high blood pressure, you're going to have stiffer artery walls. You could have some blocked arteries as well. Maybe not completely blocked, but they could have the reduction of their cross-sectional area. You could have some impaired kidney function, impaired heart function. And so when we talk about high blood pressure, there's 4 different phases of high blood pressure. And the 4 different phases are as follows. So normal blood pressure is anything below 120/80 and above 90/60 approximately. If we start to go above 120/80, we get to pre-high blood pressure. Then we have stage 1 high blood pressure. Then we have stage 2, and then we have malignant, which is by law, any doctor's supposed to call the ambulance, and you could have a stroke in a minute. And so they want you to get that taken care of immediately. Okay. Now, one of the problems is that taking medications for high blood pressure, like we said earlier, it doesn't address the cause of the high blood pressure, which in many cases is added salt and then other lifestyle factors. In the other case, if you take medications, let's suppose somebody's unwilling to do it and they want to take medications, they say, just give me the drug, I'll just last as long as I can. What you have is you have some side effects of the medications. And usually the side effects of the medications are not justified in terms of survival outcomes unless the blood pressure is about 160/100. So right around a little higher than stage 2 high blood pressure. And so you have people that might be stage 1 and the beginnings of stage 2 high blood pressure that still have increased risk of stroke, but they're not sick enough to yet justify the use of medications. And so this is where, and just to give you an idea, someone in stage 1 high blood pressure is 5 times greater risk of having a stroke than someone who's in normal blood pressure range. Okay. So what do we learn from this about fasting? Well, a long time ago, my mentor, Dr. Goldhamer, had the question, does fasting affect high blood pressure? And so he put fasting to the test. Now, at the time of the study, it was known that if you reduce your alcohol consumption from a bottle of wine a week to about a glass of wine per week, you can lower your systolic blood pressure by about 5 points. Okay, if you exercised about 30 minutes 3 times a week, it's about 7-point drop. If you take medications, it's the combination. So it's about 12-point drop. Okay. Now, salt, which is a big factor in hypertension, can reduce it by about 16 points. Now, all of these were done over several weeks, several months. Dr. McDougall actually showed them up by saying that you can actually just do the healthy diet and exercise, and just 11 days, you could have the same effect of the drugs and even just the reduction of salt. Okay. Now, what Dr. Goldhamer did was he took 174 consecutive patients that had blood pressure from different reasons. Could be the salt intake, the stiffness of the arteries, all those were on the table. And he just took generalized high blood pressure and he put it to the test. And it turns out that after an average of about 11 days of water fasting, so some people had higher blood pressure, had to fast much longer, and people who didn't had to fast shorter, but the average length of time was about 11 days. And there was over a 37-point drop, okay, in blood pressure. Okay, so this was by far the highest effect size in the scientific literature. And another study that he did on borderline high blood pressure showed a similar improvement as well. Okay, so if someone has high blood pressure and they are not looking forward to taking medications and they're trying to get off the medications for some reason, or they're trying to avoid medications, fasting appears to be the best case scenario here. Okay, now this was a blood pressure of somebody who called me last year. You can see on the date there, this was last year. They called me and they said, I need to do a fast. And so we walked them through the lead-in diet before the fast. Okay, so it's very important, and we'll talk about that later. It's very important to have a proper lead into the fast so the fast goes smoother. And so they had a blood pressure 215, 128. Okay, so you can remember, we go back, that's malignant high blood pressure. So I told them, you're supposed to call the ambulance. You could have a stroke at any minute. He says, I'm not going to call the ambulance. I don't want to go. Okay, so I'm nervous, but he's perfectly fine. I told him what to do. And in 1 week's time, he had reduced his blood pressure to 150 over 97. Okay, so it's still high blood pressure, but he had almost a 70-point drop on the top number. That's just for eating the food. Okay, and so when we do fasting at home, very often we're trying to get people to eat a healthy diet before the fast, just for a couple of days, then do the fast, improve their symptom, and then they're actually the numbers look quite normal by the time they're done. All right, our next benefit, detoxification. Now, a lot of people throw around the word detoxification, and there is actually some detoxification going on. We are exposed to different chemicals throughout the day, whether it's the air we breathe, whether it's sometimes there's food that's been contaminated. The biggest source of environmental contaminants is going to be animal products. And in this study in Japan and Taiwan, it was a group of industrial workers that were poisoned accidentally by consuming contaminated rice oil. And they had tried everything that they could think of. Nothing really worked. So they were put on a modified fast. This was 2-3 years after they'd been poisoned. They had symptoms like low back pain, joint pain, aches, pains, severe headaches, coughs, these types of things, eruptions. And after about a week of 10 days of fasting, they were effective at removing the symptoms. And they found that the concentrations of these chemicals were actually quite high in the blood, which the researchers postulated that it was coming out of the tissues into the blood to be filtered out and urinated out. Insulin resistance. Let's give a little brief overview of diabetes. Okay, so let's take a look. If we look at blood sugar rises after you eat a meal. And as it starts to rise, pancreas decides to make some insulin, and insulin starts to rise as a result. And the job of insulin is to bind to glucose and then knock on the door of the cell and bring glucose into the cell. So what happens in type 1 diabetes is that the insulin is not being made. Okay, this is some autoimmune process. There's been some destruction of the pancreas that cannot make insulin. Okay, and so that's called insulin dependent or juvenile onset diabetes. In type 2 diabetes, what's happening is the cell is clogged with fat, and as a result, the glucose and the insulin can't get in. And so this is called insulin resistance, or also adult onset diabetes. Okay. Now, if this goes on long enough and the pancreas keeps getting tired, making more insulin, and it doesn't really do a good job of it, then eventually people will become type 1.5 diabetic. And this is where someone who's type 1 diabetic or type 2 diabetic will eventually need some insulin. So luckily, if we stop the cycle, if we remove the cause of the problem, which is in many cases, I don't like to say dietary fat, it's actually processed refined foods. And so that's going to be, I don't like to use like carbs, fats, or proteins, because Does that mean you shouldn't eat any food that contains fat in it? Like avocados are perfectly fine. And even lettuce has some fat in it as well. What we want to be avoiding is refined foods. Okay. So oils, refined processed meats, dairy products, these types of things. Okay. So if you eat a lot of these foods and you remove those causes, and you give your body a chance to clear out the fat from the cells, blood sugar goes down, but more importantly, A1C goes down, and the insulin can actually, the pancreas can actually be better at functioning. Okay. Now, type 1 diabetes is not reversible, so we don't do any water fasting. There has been some work done on mice, where mice who are genetically predisposed to have type 1 diabetes, they found that if they do a water fast with them, they can regenerate the pancreas to make more insulin. That hasn't been shown in humans. I don't want to promise anybody that. That's not something we typically do. People who are type 1 diabetic, we generally just recommend that they don't do any water fasting, but they do some healthy diet and lifestyle. Okay. And Mastering Diabetes is an excellent resource for that. They have a lot of information there to learn how to do that. Okay. But for type 2 diabetes, we can actually correct A1C problems, correct insulin resistance with fasting and the diet, both. Okay. The highest A1C I ever saw was about 13%, and it got down about 6.9% in about 5 weeks. Okay. 5 weeks of fasting and then 3 months of eating the food. Okay. So that was really, really rewarding. And since then, we've seen A1Cs come down. As long as people stay on the program afterwards, it makes it much easier. Gut leakage. So in a healthy gut, what we have, the gut is a tube from one end to the other, and it's a tube where things can pass through. Okay. And so when we see leaky gut syndrome on the left side here, the junctions that prevent things from going through are very tight. And when you have enough inflammation, when you have irritating substances going through the gut, then it will actually, those junctions actually fail and they get a little bit looser. And now substances that otherwise wouldn't get through will get through. And so this is again, removing the cause of the problem. Is to actually, first off, get the things out of the gut that are causing the problem, and then remove the obstacles and let the gut actually heal itself. And so leaky gut syndrome is implicated in all host of autoimmune diseases like rheumatoid arthritis, even things like skin diseases like psoriasis, eczema, lupus, SLE, fibromyalgia, polymyalgia rheumatica. These are Meniere's disease I've seen. These are all things that respond quite well to water fasting and a healthy diet. If you haven't read the book, The Lupus Recovery Diet, this is a brilliant little expose of different cases of different autoimmune diseases of a lady who did a water only fast, recovered her lupus, and then went and interviewed about a half a dozen or a dozen other people that had a similar result with different autoimmune diseases. Now, in practice, something like psoriasis, plaque psoriasis, is a silver scaly rash. It can present on the left side here. It's a very severe psoriasis. And this is before the fast. The middle picture is after the fast. And on the right side is 2-month follow-up. Now, this was published in a journal with the True North Health Center. I'm on the board of the True North Health Foundation. So we fund and design studies to further the knowledge of water fasting and a health promoting diet. Here's a couple of pictures from patients of mine that I worked with. So here's a lady who was in a very public profession, and both of her hands looked like the one you see here. This is her left hand, but both of her hands had this little rash, and she had to shake hands a lot and was a little bit embarrassed that when she would shake hands, people say, "Oh, your hands are so dry." Or sometimes if it would get really bad, they think she was bleeding. And so they would be a little bit uncomfortable. So this was day 1 of her water only fast. This was day 9. And then this was day 16. So the light's not that great in this particular picture. You can see it's just a little bit left here on this left hand. Her right hand, you can see it's a little bit worse. So this is day 1, this is day 9, and then day 16. You can see just a little bit left over here, and it's all gone away for the most part. This was another lady who this is right below her hairline, and she always wanted to go to, put up her hair when she goes out with her husband, was kind of embarrassed for that. But she was eating a very clean, healthy, plant-based diet, but just for some reason, the psoriasis wouldn't go away. And this was day 1 of her fast, and this was day 5 of her fast. So we got a very, very good outcome here, a very quick, rapid outcome. Didn't expect that. Okay, so rebalancing the stress response. So it turns out, it's no surprise that when we are going about our business all throughout the day, most of our lives are going to be dominated by a stress response. Okay, so we wake up to a blaring alarm clock. Sometimes people wake up and you have to splash cold water on their face. They might drink a nervous system stimulant like caffeine to get up in the morning. God forbid someone smokes a cigarette to get up, but they have to fight through traffic. They go to work, they're getting stressed right and left. This is not a happy existence for our nervous system. Okay. And what happens is you get out of balance. Now you're short with your wife or husband, and you're just not, anything can set you off. What fasting appears to do is to rebalance that stress response. Okay. So this is called increasing the parasympathetic tone. Okay. Your nervous system that's responsible for relaxing on the beach in Hawaii. Okay. And so fasting appears to tone this part of your nervous system. And so you may, if you go back to the stress that you are typically going to, you'll eventually get to the same response. But it can help bring things back down so you can gain some perspective and maybe decide if you want to be in that stressful environment moving forward, and it give you some clarity to maybe brainstorm our way out of it. Okay. Immune system enhancement. So this can go all the way from short-term sniffles, allergies, being frequently sick, frequent colds, frequent infections, even things like UTIs, and it can go all the way towards cancer. So a little bit more research is coming out on cancer. A lot of it's in mice and rats, but it's starting to say, we're starting to see that fasting does appear to decrease tumor growth factors along with diet like IGF-1. But also when we're doing a fast, we're also talking about removing the unhealthy diet that could be contributing to the cancer, decreasing inflammation, improving your immune system. And so when we put it into practice, it looks like this. A lady came in to True North Health Center with stage 3 lymphoma. Now, stage 3 lymphoma is a blood cancer. It's not genetic, but they believe it's some sort of environmental cause. And this lady had asked her doctor, is there anything else I can do? And the doctor told her, honestly, the oncologist said, this is not as serious as we need to do treatment right away. So all we can really offer you is to watch and wait for about 3 months. So every 3 months, we're going to check you again. And then if it gets worse, then the drugs and the treatment is then worth it. And so she did a water-only fast, 3-week water-only fast, and then did a follow-up CT scan. And it showed that after the CT scan, after the water fast, the lymph nodes were substantially reduced. And then 3 years later, they did a follow-up. We did a follow-up on her. And after 3 years, there was no more evidence of follicular lymphoma. And there was no evidence of hypermetabolic neoplasm, which is another word for cancer. Okay. First case study for water fasting and cancer in humans. Now, since then, I've seen a number of people who have had cancer. The follow-up is difficult because the question is you see them a year from then, 5 years from then, how much do we really following them up? Do we know how they're doing? I had a lady who was trapped. Her government would not let her out of her country during the COVID pandemic, but she had just found out she had lymphoma in her breast. And she said, I have 2 small kids. I can't leave. First of all, I can't sneak across the border. So I have to do a water fast or a juice fast even. So we agreed to do a juice fast so she can continue caring for her kids and doing some other things during that time. And we did only a short fast. We did a week of juice fasting, and then she did a follow-up ultrasound. And it turns out that in follow-up ultrasound, they found that the breast lesion had regressed in size, and it was a small regression. And she is set to do another fast probably in a few months. But it was very interesting to watch this thing. And since then, a lot of lymphoma in patients that I've seen, they tend to respond quite well to a water-only fast. And so yeah, there's a lot of different types of cancers. But again, if we apply the idea of removing the cause, in all these cases, we first address a healthy diet and lifestyle. Okay, and then we can experiment, see if water fasting may be the right move or not. All right, so what we have here is a whole host of fasting benefits, all from doing absolutely nothing at all. Okay, just sitting there, drinking water and resting. And as a result, we have these conditions that appear to respond very well towards fasting. And so we're doing nothing at all. This is what Dr. Goldhamer calls doing nothing intelligently. And this is also why I call fasting nature's balancing act. Okay. Oftentimes, the modern world presents us a large number of distractions and a large number of things that we're doing that causes us to get out of balance, whether it's through diet, whether it's through sleep, whether it's through exercise, emotional support. All of these things can cause us to shift so far in one direction that we have to swing the pendulum the other way. Okay. And this is where fasting can really, really shine, as you've seen. Okay. So now let's quickly, we've got a few more minutes and we'll go to the Q&A. So just get your questions ready. Let's now specifically talk about remote fasting. So clinically speaking, we are following the same guidelines as we would if you were to come to my clinic a few years ago. Okay. In other words, we still do a pre-fasting consultation. We still review your health history. We're still making sure that you are a good candidate for fasting. We're doing pre-fast lab work, checking your checking your electrolytes, checking your kidney, liver function, other things. We're also doing daily vitals, making sure you're drinking enough water, making sure that the key here is that you have enough rest, and then also doing a guided refeeding with some recipes. And you're actually getting your hands dirty and practicing the foods that you're going to be eating moving forward. And some things to consider that I get asked a lot is, how long should I fast? And this is different for everybody and different for the conditions. Generally speaking, the more chronic a condition, the longer we want to fast. The more acute a condition, the shorter we need to fast. And we also have some other considerations like, how much time do you have with work? How much time or how much weight what do you weigh? Do you have enough reserves to go that? There's also some home life. I've had a number of people who will book an Airbnb because home is just too crazy for them to do some sort of water fast. I've had friends that will book a house together somewhere and do a water fast, 3 or 4 people at a time, just so they can support each other. And then the refeeding is a little bit easier as one person maybe finishes sooner, and then they can all help each other that way. Medications is a consideration. People with thyroid medications can do a fast on these medications. Other medications we need to talk about because you may need to taper off of them before you do a water fast. But this is why I have Dr. Renee Thomas on my as part of my medical director team, is that she can talk to you and help you wean off the medications, or you can do that with your local doctor as well. And we can walk through what a typical food program would look like in order for you to wean off the medications. A question about working during a remote fast. We certainly don't want you driving around and running errands, but if you have a remote job, sometimes you can get away with a few hours here and there. But the whole idea is to do a fast at the right time in the right place and the right mindset, so that you're not being pulled from every direction and that you're just barely focusing on helping yourself and healing yourself. Refeeding plan also means we want to make sure we have a good place that you can cook food, healthy food, and set your life up for success. And if any of those are not possible, then we start thinking of maybe we do a modified fast. Maybe we don't do a pure water only fast, which can be quite intense, can be quite miserable. Instead, we might do a modified fast where maybe for one entire week, we do nothing but soups and salads. Okay. Or maybe we just do a complete SOS free meals for 7 straight days. And we walk you through that every single day. Okay. Or perhaps we do some sort of juice fasting or broth fasting or an elimination style diet if you're allergic to certain foods. Okay. So these are all the different options. But if we can complete some of these options, we now get on track for success. And what a successful program or successful fast looks like is that you feel incredibly well rested. Oftentimes we're just sleep deprived and we just need to rest. Okay. We're getting back into exercise after a fast. Your symptoms are going to be reduced or gone. We've broken the cycle of unhealthy habits. And what we're really doing is planning for the future, because there's no cure for any of these diseases I've talked about. Okay. Your body has to heal itself, and we have to support the body in order for it to continue. And if we do this, we give ourselves the best chance possible to have a healthier life. And so we go back and we ask, can fasting help you overcome your health challenges? And the answer is, well, whether it's something straightforward, like we said before, like getting back on track with a healthy diet, or something very serious, we have to remember your body has what it takes. Okay. It has the capability and the ability to improve itself, to heal itself, and improve your life. And then all we have to do is get out of the way and watch the process unfold. And so what I'd like to do now is we can, I'm going to actually stop the share screen, and then I can actually look at the chat comments. And if I don't know, Sharon, if you want, is anybody going to unmute themselves and ask a question, or are we going to do this chat? The chat.
I can read the questions.
Oh, perfect. Okay.
So
Okay.
first of all, thank you so much. It was so thorough and so informative. And I love what you said about the body knows how to heal itself. Just get out of the way. Really amazing how many success stories come out of this. And I think I had heard that even a 3-day water fast can be effective. Is that right?
Oh yeah. Yeah. There's no set time. What we do is we want to fast as long as we need to, but as short as possible. Okay. And this is there, you can see there's a lot of variables here. So some people, they say, you know what, I can't take any time off work. So we say, okay, well, let's see if we can do Thursday through Sunday. You don't necessarily need a doctor's supervision for that, because it's kind of like you got sick for 3 days. Okay. When we start to go longer than 5, 6, 7 days, it's just more risky, and it's good idea to get some blood work done and just get some supervision there. But for short fasts, it's totally fine. And those can oftentimes be the difference between, breaking the cycle or, eating the next bag of Oreos the next day too.
One question I have is this is probably a basic question, but how much water should you drink? Should you drink half your body weight if you're doing a water fast, or is there a recommended amount?
Yeah, there's general principles. So usually I recommend people are somewhere between a half to a full gallon per day. But it's going to depend on how much people weigh, how thirsty they are. The half to a full gallon is a big range. So, yeah.
Okay. So from the chat, you did sort of address this question. It sounds like this would be one for your medical director, but Bernadette would like to know, Dr. Joel Furman says you can't be on meds and fast. I have RA and take Enbrel and Celebrex. Please comment.
Yes. Yeah. This is 100% correct. You do not want to fast on those medications. And so with rheumatoid arthritis, that's going to be, that's what we want to be doing, is see if it's possible to be phasing off the medications. Now, it can be tricky because if you phase off those medications like Celebrex or Enbrel, you may start to get more pain. And so that can be tricky. And so if you aren't already on a whole plant foods diet, then Dr. Thomas will walk you through how to get on a whole food plant-based diet. And maybe we might do a modified fast if it's not possible to get off the medications. But yes, we phase everybody off medications before they start water fasting. And we time it so that you take your last dose and then you start water fasting right after that. And so with blood pressure, it's more straightforward. With things like rheumatoid arthritis and the biologics that you're on, it may be a little bit more challenging, but that would be our strategy.
Great, thank you. So you mentioned a resource for healthy diet and lifestyle for type 1 diabetics. Is that Mastering Diabetes?
That's correct. Mm-hmm.
Okay. And then Bernadette would also like to know, do fasting benefits reverse when the fast ends?
Sometimes, so the fasting benefits typically do not reverse unless we go back to eating the diet and lifestyle that caused the problem in the first place. Okay. Now with RA, rheumatoid arthritis, sometimes it could be a little bit more challenging because there could be some food allergies as well. And so you might, put in a tomato in your salad and not realize it, and then you flare up after a fast. So with rheumatoid arthritis, it can get tricky because we may even have to try an elimination style diet.
Great.
But generally speaking, no, the fasting sets off a beautiful chain of events that ends up healing most of these issues.
Amazing. A couple of people are asking whether water fasting is beneficial for osteoarthritis.
Yeah, it can reduce some of the inflammation, and it can reduce. So osteoarthritis is different from rheumatoid arthritis. Osteoarthritis is when the bone itself is starting to have some inflammation. And so if someone is, say, overweight, that will put pressure on, say, the knees or the hips, and that will exacerbate that osteoarthritis pain. But as a general principle, it cannot reverse osteoarthritis because it's a long process that started, probably decades ago, from the joint cushion being much lower. So yeah, we can reduce some of the temporary inflammation, and we can reduce some of the weight pressure on the joints. But the actual, what you can see on the X-ray does not change very much after a water fast.
Okay, thank you. Any benefit for spine abnormalities causing pinched nerves in spinal column? Spondylolisthesis?
Yeah, same idea is not a very specific diagnosis, but it doesn't have to be. What we want to be doing is helping the body improve itself. Okay, so reducing inflammation, letting it fix itself. In the case of spinal problems, as a chiropractor, I always recommend do some physical therapy. Okay, you can nowadays, there's some excellent physical therapy videos online that will walk you through. You just pick where your problem is and you do those exercises and do them consistently, and your body can heal itself if you do them. And you do the exercises, and then, you know, if you have a time to do some fasting, that can also reduce some inflammation.
Great, thank you. Are there any age restrictions for fasting? Is it okay for someone who is 72 and wants to get off of meds? And if so, do you need to stop all high blood pressure meds and statins before or during the fast? Any health crisis risk if you do this medication halt?
Yes. So we want to, I would say to this person asking, book it. You can book a free consult with me on my website, fastingescape.com, and we can walk through some of the ins and outs of this. But yes, the shorter answer is yes, it's possible. I do this routinely with people. And if they can talk to their local doctor and help them taper off their drugs, or with Dr. Thomas, yeah, we walk them through that process and then start the fast. Because when you get off the meds, the blood pressure will go up a little bit. And so what we want to do is get on an appropriate diet to time it so that you can lower the blood pressure, lower the medications enough to where you can start the fast. And then when you're off the medications, the blood pressure will go up a little bit, but then the fast effect will come in. And so then it'll lower the blood pressure again. So it's a bit of a tricky situation, but it's possible. I've done it, you know, hundreds of times in the last 11 years I've been in practice.
Great. Okay. Any other questions before we wrap it up? Oh, Stephanie wants to know, does your metabolism slow down and stay lower after the fast? And how slowly should people return to a normal calorie level and activity levels?
That's a good question, Stephanie. So the thing to keep in mind is that your metabolism is dynamic. So it responds based on what you're doing. And when you do a water fast, your metabolism will slow down, and it will take a few weeks as you return back to your normal activity levels for your your hunger to return normally, for your activity to return, for your energy to return. And so it's different for everybody. If you do a week, for example, I did a 5-day fast, a couple of years ago when I got COVID, and a week later I was playing a full speed hockey game with a short bench. Okay. And so, but other people may do, a week of fasting and they might feel very tired for 2 weeks. Okay. So there's going to be differences there. But in general, what we do is we watch the body carefully to make sure that there's nothing wrong going on. And then we just then we give it enough time. So if somebody is very tired after a water fast, we might encourage a little bit more exercise and activity levels. So they might start walking a little bit, doing some squats and some push-ups. And that way you're essentially signaling to the body that the food has returned and it's time to start walking around and start doing things again. And then your metabolism will respond in kind.
Fantastic. Okay. One more question. This is the last one. Is it more important to establish a healthy eating pattern before trying a fast?
Yeah, it's hard to establish a healthy eating pattern before the fast because if people could do that, then they wouldn't need to be fasting. And so it's not as easy as just establishing a healthy eating pattern. What we want to be doing is recognizing that an unhealthy eating pattern is an addictive process. And so if we break that cycle and get you out of that addictive process and then detox in the same way that you detox from caffeine or other drugs, okay, if we detox that process, if we detox you, get out of that process and then get that momentum back and you have more energy, all of a sudden it's actually a natural and seamless transition to eating healthy. Okay. So just if we imagine someone's addicted to coffee and every day they can't prevent themselves from drinking coffee. They go through their 3 days of no coffee, get the headaches, the nausea, the vomiting, they're out all of a sudden, and they get some sleep. And all of a sudden now they don't need to drink coffee anymore. Okay. Because they don't need to use it. Okay. Similar way for food. So yeah, in an ideal world, yeah, you just eat healthy, but that's not that simple in practice. And so we're using fasting as a way to break the cycle partly, but also as a way to essentially improve the functioning of the body.
Great. Okay. One last question, if you don't
Sure.
mind. This should be a short
We
one.
have plenty of time.
How often Okay, how often do you recommend fasting for a healthy person?
Yeah, it's a good question again, Stephanie. So there's no set amount of days of fasting for a healthy person. How I like to think about it is if you eat your normal natural meals, salad, cooked vegetables, starches like potatoes or rice or beans or oats, and you don't need to add a whole bunch of salt and oil and flavor enhancers in there, and it tastes really good, then you're fine. Okay. The minute you start to feel like, oh, shoot, I can't really eat this unless I put some salt in it, probably probably a sign that it's time to do a short water fast. Okay. Other than that, if you're not a very healthy person, you may need to consider that your diseases or your dis-ease is being caused, or at least it's being contributed to by an unhealthy diet and lifestyle, at which point we consider whether or not fasting is a good idea. But yeah, it depends. Some people will like to do a fast once a year. Some people like to do a couple of days, a few months here and there. There's no right amount of time. It depends on how you're feeling, what your taste buds are telling you.
Great. And people can request a free consultation with you or Dr. Thomas, is that right? If they go to your website?
For me, it's a free consultation. You can go to fastingescape.com. There's buttons there that says get started, and it'll walk you through scheduling that with me. With Dr. Thomas, it's a paid consultation. She does wellness consultations, and she also does medical, like official telehealth medical visits. Depends on which state you're in when you talk to her, but that's all on her page under her about Dr. Thomas on the website as well.
Fantastic. Well, thank you so much for all this wonderful information. If anyone has questions about the program, please get in touch. Are you on social media at all? Is there a place people can follow you if they're on social media?
Oh yeah, you can just go on my website. You can get in touch with me there with the free consultations. You can email me. The email's drnathan@fastingescape.com. Yeah, we have a few Facebook pages, but in concert with trying to avoid social media too much, I admittedly am not on too often. And so we just like post little updates and newsletters and things like that. But if you have any questions, feel free to email me. And if you're thinking of doing this, just book a consult. We can chat about it and see what makes sense.
Great. Would you like to tell them about your podcast also?
Oh yeah, it's just a little side thing I do. I do a podcast with Dr. Doug Lyle and Jen Hawk. It's called Beat Your Genes. That's a fun one. It's not diet related, so it's just about psychology, and so that's it's a little side thing that we've been doing now for about 6 years.
And where can people find that?
Oh, on any podcasting app, iTunes, Spotify, all these things.
Fantastic. Well,
Yeah.
thank you so much again for all of your time tonight, all of this great information. Thank you everyone for being here. I did record this and I will send out the recording to everyone who signed up. So hope to see you again for the next meetup. And thank you again, Dr. Gershfeld. Have a
Hey,
great.
thanks everybody for joining. Really appreciate you guys having me on.
Thank you. Good night.